So, welcome everybody. Today's topic is personality disorders. A very interesting topic, a very interesting symptomatology and etiology. So, let's just dive into it. So, the outline of the lecture will be first an introduction. Then we'll see that why are personality disorders so underrated? Why should they be recognized? What is personality? And then, of course, what is a personality disorder? So, personality disorders, they are the commonest conditions handled by psychiatrists. Almost 20 to 30 of our outpatients and 30 to 50% of our inpatients do suffer from personality disorders. However, they are often neglected and untreated for a variety of reasons. So, why are they untreated or what is the difficulty? One is diagnostic criteria is confusing. Second is difficulty differentiating normal from abnormal. So, we'll see what these are in the subsequent slides. Again, classification is a problem. Patients are also quite difficult, they're not very cooperative sometimes. And then the treatment part is also challenging. So, what is the importance or what is the significance of identifying these personality disorders? One is it improves the treatment also, and second is the patient is also more comfortable with a doctor who's treating all the types of illnesses or all the distress that he's suffering from. So, what is a personality? There's no exact definition, but it refers to the patterns of thinking, feeling, and behaving. So, how you respond to a particular environment or a stimulus is what is personality. But it is a biological and psychological combination of the two. So, personality we see from different areas or different types. One is the temperament. So they can be either genetically determined or biologically based. So the temperament is seen from childhood. Or whenever we are talking about temperament, it's usually in children. Character is something which results from experience. So this is something you develop over a lifespan and it is seen more commonly in adulthood. And a combination of temperament and character is what constitutes a personality. So, temperament refers to the biologically hardwired things which are present in a brain. They can be genetic also. So, by genetic, if a person's parents or a single parent is very hot tempered, so you will see that temper comes in the children also. So, this is what is meant by biologically or genetically based. Now, components of temperament. So, Cloninger was the scientist who gave these. One is novelty seeking. So, novelty seeking means seeking new experiences or new things. Second is harm avoidance. So, some people don't avoid harm a lot, they try to take a lot of risks. So, risk taking is something which is determined by harm avoidance. Then reward dependence also. Some people don't care if they get reward or not, but some people or some personalities are dependent solely if they'll get a reward or not. Then persistence is also personality character. Coming to character, it is the aspects of personality that are shaped by the life experiences. So they can be individual experience, social or cultural experiences, and it is not distinct from temperament, but it is something which develops over a lifetime. So, character can also be seen as cooperativeness, self directedness, and self transcendence. So, these are all the points which we see in personality. So again, what these are just a detailed description. So in novelty seeking, it's the tendency to respond to a new stimulus or a novel stimulus, or boredom to familiar stimuli. So this is based on dopamine and D4 receptors. It's okay if you don't remember, just remember what novelty seeking is. Then harm avoidance is tendency to avoid harm or harmful experiences. Reward dependence is tendency to perform those behaviors that lead to obvious reward. And persistence, you all know what this is. Persistent is the tendency to persist in a task even in the absence of reward, or if even if the task is difficult, they keep on doing it or they keep on persisting in it. Cooperativeness, the ability to collaborate with others. So cooperativeness is again self directiveness is the ability to set and work towards goals and targets. So how you are directed towards your goals is self directedness. Self transcendence, now I know this is a very big word, but it is just the ability to transcend the immediate material environment for higher. So this is what spirituality is. So when you seek a higher meaning in life or a higher meaning in the immediate environment, this is what transcendence is. We have a lot of other models also. This will be a 10 class lecture if I describe everything about personality. But I'm just telling you the main ones or the easier ones. So another is your 5 factor model of personality. It describes personality in basically 5 dimensions. So the acronym is OCEANS. So O is your openness. So openness is again seeking new experiences or open to new experiences or not. Conscientiousness. Conscientiousness is do you have conscious? So if you do something wrong, how guilty you feel about it. Some people don't feel guilty at all. Some people feel guilty even if they make small mistakes. So this is what conscientiousness is. Extroversion is how you react to new people or in a social group. So some people are introverts, they don't like to interact a lot with new people. Some people are very extroverts, they'll go and talk to new people and take new experiences. So this is what extroversion is. Agreeableness, again, if faced with a task or if faced with a situation, how agreeable they are with other people and with the environment. Some people are very cooperative and agreeable, but some people are not. Neuroticism basically means anxiety. So again, some people become anxious even in small situations, even in small things, and some people उनको कोई फर्क नहीं पड़ता कितना भी एग्जाम हो कितना भी ये हो they'll be very calm, cool and relaxed. So this is what neuroticism is. So, in short, we have just very quickly discussed what personality is or what are the points constituting personality. Now, let's come to disorders. So, see, all personalities will not go into disorders. A lot of personalities are normal, but personality disorders are maladaptive and inflexible. So maladaptive means they do not or they help you in adapting in a very negative way. And inflexible means they'll have the same pattern in all different situations. So they can lead to disturbances in affect. Affect means emotion basically. Cognition, impulse control, and interpersonal relationships also. So this is when we call it as a personality disorder. So the 3 rules or 3 P's are that they should be pathological, then they should be pervasive, that is, multiple aspects of life should be affected, and they should be persistent, that should be stable throughout the life. So if you're stressed or if you're going through a bad time, then it's okay if you're not reacting in a good way. But if they are persistent throughout life or throughout the situations, then they are called as personality disorders. So, again, personality disorders can be classified into 2 types, categorical and dimensional. Categorical means they're put into categories. They can be classified according to DSM or ICD. Dimensional approach is mainly used in psychological research. We don't use it in the hospitals or in our clinics. So let us look at personality disorders. Like I've said before, they're long-standing, pervasive, inflexible, extreme and persistent patterns of behaviors. They are unstable, positive sense of uh, self and unstable in relationships also. So DSM-5, DSM-4 uses clusters. So this is what we are going to discuss in the next few lectures. So what are the three clusters of personality? We have three clusters which can be described as odd and eccentric, dramatic and erratic, and anxious and fearful. So let us see what these clusters are. We have cluster A, B, and C. Okay, you need not go into again a lot of details, but just know the superficial parts of it. So, cluster A is your odd and eccentric cluster. In this, we have paranoid personality, schizoid, and schizotypal. Cluster B is your dramatic and erratic cluster. So in this we have antisocial, borderline, histrionic and narcissistic. We'll discuss what these are, but this is just an overview. Cluster C is your anxious and fearful personalities. So we have avoidant, dependent and obsessive compulsive. So just look into this, and the risk factors for developing personality disorders. One is abuse or neglect in childhood. Sometimes parenting styles also uh, are implicated in personality disorders. And twin studies show that there is a heritability. So again, genetics do come into play in personality disorders also. So looking at the odd and eccentric cluster, they are similar to but less severe forms of schizophrenia. So we can't actually classify them as schizophrenia, but you can just imagine them as a very, very, very mild form of schizophrenia. So we have paranoid personality, schizotypal, and schizoid. I'll just tell you the main points of all these. So, in paranoid personality, these personalities are very suspicious of everything. As the name suggests, they are very paranoid. So, even if their friends or their family members will do something nice for them, they'll feel that no, they have some ulterior motive, or they are going to do some harm to me, or they'll bear grudges also. So, especially on the life partner, fidelity or suspiciousness or infidelity is also seen. So, just remember, paranoid personalities, they are paranoid about everything. Even if you do something good for them, they'll feel that they are going to do something bad. They'll bear grudges, and infidelity is very commonly seen. Now, schizoid personality. Schizoid are the crux of this is they don't like socializing. They are asocial. So if you have to describe schizoid personality in one word, that will be asocial. So they will lack desire or enjoyment of close relationship. So they like being alone. They'll be very happy if they are alone and they don't have to interact with people. And if any of you have watched Big Bang Theory, this is what Sheldon can be described as. So this is schizoid personality. Schizotypal personality. Now see, schizoid and schizotypal सुनने में एक जैसा लगता है, but they're very different. Schizoid, just remember Sheldon if you have watched. Schizotypal are the closest to schizophrenia. So it is a if you see the name, it is a type of schizophrenia. So schizotypal. So in this, you'll see again unusual and eccentric behaviors. So there will be odd beliefs or magical thinking. Sometimes they'll feel that I have telepathic abilities, or they'll feel that people are referring about me, talking about me. They'll sometimes have illusions, they'll wear strange clothes, they like talking to themselves. So this is what schizotypal personalities have. Basically, they're very odd and eccentric. So again, if you watched Friends, so Phoebe was schizotypal. She'll wear very different clothes. She'll wear rings or believe in crystals and all these things. So this is what is schizotypal personality. Diagnostic criteria you need not remember. I think we can skip this. Let's go to the most interesting forms of personality disorders. These are your dramatic and erratic clusters. So in this we have antisocial personality, borderline personality, histrionic and narcissistic. So antisocial personalities. Antisocial personalities, the main thing you remember about them is they have a disregard for the rights of others. They are having patterns of behavior which are very irresponsible. So they like to break laws, they'll get into fights, they'll be physically aggressive, they'll take a lot of loans and debts. They will lie a lot. So pathological liars also come into mostly antisocial personality disorders. uh, why they are called as antisocial? Not because they are asocial or they don't like socializing. Antisocial means they will go against the rules of society. So antisocial means anti-society. So they don't like to follow rules. They feel that the rules don't apply to me. I don't have to follow the rules, and hence the name antisocial personality. Again, we have diagnostic criteria. Usually, we don't diagnose it till 18 years of age. Before 18 years, if we have to diagnose them, they usually come under conduct disorder. So again, if the patient has conduct disorder, a very high chance that they'll develop antisocial personality disorder in future. Okay, so again, there will be repeated law breaking, there'll be lying, impulsive, irritable and aggressive, reckless disregard for safety of others, very, very irresponsible, and they won't have remorse or guilt about themselves. So, most of the jail inmates or most of the people who break the law usually suffer from antisocial personality disorder. Looking at etiology, uh, problems with research was that this was done mostly in criminals. So again, a very biased sample was there. But genetics do again play role. 40 to 50% of antisocial behavior was found to be heritable, and a genetic risk was there. Family environment also plays a role. So if there is lack of warmth or a high negative environment in the family, parents are not consistent, or parents are again very strict or very lenient, both these ways. Sometimes poverty, exposure to violence in the childhood does play a role, and family environment interacts with genetics, and this then gives rise to antisocial personality. Again, in etiology, uh, some things or some attributes like fearlessness or lack of fear or anxiety is seen, and this can be seen when we measure the baseline levels of skill conductance. Or a lot of research was done where they were found to be less reactive to aversive stimuli. Aversive stimuli means harmful stimuli. So their response to harmful stimulus was very, very less. So these people were found to be fearless. Impulsivity was seen. So lack of response to threat when pursuing rewards was seen, and deficits in empathy. So they were not in tune with the emotional reaction to others. So they lack empathy, they have impulsivity and fearlessness. Now coming to the next interesting personality disorder, that is borderline personality. So again, they have a few criteria of few things which are seen specifically in borderline. One is impulsive or self-damaging behavior. So a lot of times in our emergency or in our OPD, we see patients who have come with cut marks on their forearms or cut marks on their legs or on their body. So they will have impulsive and self-damaging behavior. They'll have unstable relationships. They have problems in emotional reactivity. So again, small stimulus is given, but their emotional reaction is very, very high. And they have abandonment issues. So a lot of efforts are taken to avoid abandonment. So they like to cut themselves mostly at times when they feel that people are abandoning me. So if their parents scold them that you're not doing well in college or you're not having a good job, they feel that now I'll be abandoned or something, and then they'll cut themselves just to get that validation. There's an unstable sense of self. Anger control problems again go hand in hand with emotional control problems. They have chronic feelings of emptiness. Again, like I've told you, recurrent suicidal gestures are there. Transient psychotic or dissociative symptoms will also be there. So these are known as micropsychotic episodes. But psychosis is not so much so that you can classify them as schizophrenia. These psychotic episodes will last for a few minutes or maybe a few hours, not more than that. Again, borderline personality disorders, maybe later in life they'll grow out of it. So uh, they may no longer meet the diagnostic criteria for borderline personality, but they are at very high risk for developing PTSD, major depressive disorder, substance related disorder, eating disorders. So ruling out all these things and ruling out all these comorbidities is also very important. Again, diagnostic criteria you need not know. Just know what are the main symptoms. They are the ones that are same as diagnostic criteria also. Etiology again, we have genetic, we have problems in serotonin functioning. CT MRI scan was done, so it was seen that there was increased activation in amygdala portion of the brain. Social and environmental factors also do play a role. So again, there is a stress diathesis theory in which they say that borderline personality disorders, they have difficulty controlling their emotions, but this difficulty in controlling emotion is usually based on biology or biological diathesis. Then again, we have a family which invalidates these emotional experiences, and interaction between the emotional reactivity and invalidating fact, the family gives rise to borderline. So both these in combination will give rise to borderline personality. And parental separation, verbal or emotional abuse during childhood again is a risk factor for borderline personality disorder. So this is again in chart form. So you have biological diathesis or a biological predisposition. This will give rise to emotional dysregulation. So there is a great demand from the family. So family will react in a negative way, which will cause emotional problems, and then these emotional problems again will cause family problems. So this is a vicious cycle which needs to be broken, and this is what we do in therapy. We try to break this cycle. Now coming to histrionic personality disorders, so they are again very interesting to see. If again you have to describe it in one word, you will describe them as attention seeking. So again, I'm sure you have one or two friends who like to be the center of attention, who like to be the life of party. I'm not calling them as histrionic personality, but just remember their traits to remember the histrionic personality traits. So they have a strong need to be the center of attention. They'll have rapidly shifting emotions. They'll use physical appearance to draw attention to themselves. They'll have exaggerated theatrical expressions so that people give attention to them. And they might sometimes misread relationships as more intimate as they are, because they feel that people are giving them attention. So they feel that, yes, I do have a relationship, which is actually not true. Narcissistic personality. Again, I'm sure you must have or at least heard this word narcissistic, because it's used very commonly. Narcissistic means somebody who loves themselves and nobody else. So they are self-engrossed or self-centered, and I can see a lot of you smiling. So I'm sure you have a lot of friends who are narcissistic, but again, not I'm not saying that they have narcissistic personality, maybe just some traits. So yes, they are self-centered. They want constant attention. They don't have empathy because बाकी लोगों का क्या है वो उन पे उनको कुछ ध्यान नहीं, अपने पे ध्यान देना है. So this does lead to a little bit of arrogance, envy, and entitlement. Sometimes they have grandiose views of themselves. So वो इतने अच्छे होंगे भी नहीं जितना उनको लगता है कि वो है. But this is just a view of themselves. They are very sensitive to criticism. So they become very angry when they are not admired. They want कि people उनकी तारीफ करते रहे. जितना उनको लगता है कि हम इतने अच्छे हैं, बाकी लोगों को भी लगना चाहिए. So they seek out high status partners also because they feel that that is what they are. Diagnostic criteria you need not know. This is the same as the symptoms which we've seen. Again, no need to go into the details, but in etiology, just remember that again there are childhood problems. Childhood problems can put you at risk for narcissistic personality, but we have social cognitive models also. So again, a combination of childhood experiences and social experiences gives rise to narcissistic personality disorder. Last, please bear with me for 10 more minutes. We are done with two clusters, odd eccentric clusters and the dramatic clusters. Now coming to the last clusters, that is the anxious and fearful cluster. So we have three personality disorders in this: avoidant, dependent, and obsessive compulsive. These are called as anxious or fearful because irrespective of whatever is the personality, they'll always be very sad, they'll always be very anxious. So avoidant personality disorder, they just like to avoid people or avoid situations, as the name suggests. So they don't like being criticized or being rejected. They'll avoid interpersonal situations, or even if they have to interact with people, it will be a very restrained and a very inhibited reaction. They'll avoid taking risk or trying new activities because they don't want to be embarrassed. They feel that if I do something new, I'll do it wrong, or वो मुझसे गलत हो जाएगा, and then I'll be embarrassed, so it's better not to do anything. They have a high comorbidity with social anxiety disorder because a lot of symptoms do overlap, and Japanese syndrome can also be seen, which is very similar to this. High comorbidity with depression also. And again, looking at the diagnostic criteria, more or less the same, but just remember that they don't like being rejected, they don't like being embarrassed, and hence, because of that, they avoid social situations, they avoid most of the things. Now, coming to dependent personality disorders. So, as the name suggests, they are dependent on other people. So, again, I'm sure you have a lot of friends जो खुद से कोई decision नहीं ले पाते हैं. They need other people around them, and most of the time they have difficulty making decision. So, there is a need for others to take responsibility for them, and especially in major areas of life. and they won't disagree with people because they'll feel if I disagree they'll just go away, and how will I be dependent on them then? There's a feeling of helplessness when alone. So these people will never be able to be alone because they are dependent. They will always need somebody to take care of them, somebody to take decisions for them. And if one relationship ends on which they are dependent, like a parent or somebody who was taking care of them, if that relationship is stopped or it is disrupted for some reason, they will seek somebody new to be dependent on. Okay, there is a preoccupation with fear of taking care of self. They feel that somebody else should take care of me. So, this is your dependent personality. Coming to obsessive compulsive personality, this is very different from OCD, which is obsessive compulsive disorder. So there is just one word which is extra in this, which is personality. So how is this different? Personality disorders are present from usually 18 years of age. OCD is developed at a later stage. And OCD is there only in specific areas of life. OCPD or the personality will be there throughout. So, mostly people who are called as perfectionists are people suffering from OCPD. They are preoccupied with rules, details, schedules. They like organizing things. So, again, coming to friends, Monica was OCPD. She liked everything to be very clean and organized. They are control freaks. So, they are not very rigid and flexible. They want other people also to follow these rules. They're reluctant to make decisions or delegate their work to others. They're very, very focused on work, and it is different from OCD, but they can have a comorbid avoidant personality, or sometimes depression can also be there. Very little research on etiology, but knowing the main symptoms or main clinical features is also enough. Again, diagnostic criteria is more or less same as the clinical features or symptoms. Now coming to treatment, because in the starting of the lecture I told you that treating these personality disorders is a challenge. So let's see what are the treatment options. Personality disorders, they are very difficult to treat. They have interpersonal problems. So these problems come out in therapy also. So they will try to manipulate the therapist, or they will try to have arguments with the therapist. So this makes therapy a little bit difficult. But we have medications also. So sometimes adding antidepressants and mood stabilizers do help, as we had seen that there is a genetic problem also, there is a biological problem also. So if we give medicines, this genetic and biological problem may decrease. Then we have DBT also. So DBT or dialectical behavior therapy, this was made specifically for borderline personality disorders. So in which we teach the patient acceptance, we teach them empathy, and we also give them CBT. CBT is cognitive behavior therapy, but CBT is used in depression and all other uh, disorders also. But DBT is specifically for borderline personality, in which we teach these patients emotional regulation techniques. We teach them social skills training also. Another new therapy which was found is mentalization based therapy. So, in which we teach the patient again to think about others' feeling and not their own. Sometimes schema focused cognitive therapy is also there. Uh, Try to remember the names, but if you're not able to remember, it's still okay. Just remember, we have medications, we have therapies also. The therapies are all very, very challenging, but we can at least try to treat them. Treatment of schizotypal and avoidant and other personality disorders. So, in schizotypal personalities, we can give antipsychotics because again they're very, very close to schizophrenia. So, sometimes antipsychotics do help. Sometimes antidepressants also are helpful. So in very, very low doses, we can give antidepressants and antipsychotics for schizotypal personalities. Avoidant personality disorders are again, like I've told you, they have comorbid social anxiety. So we can use the same treatments that we use for social anxiety, that is antidepressant medications and social skills training. So if we use the same treatment, sometimes these patients are able to recover from the avoidant personality that they have. Psychopathy is your antisocial personality, your narcissistic personalities, and histrionic. So all the cluster B personalities or the eccentric personalities, we can again treat with psychotherapy, either CBT or psychodynamic therapy. So mostly medications are not used, but therapist should be very, very patient. It's a very challenging thing to treat, but we can try psychotherapy, we can try CBT and try treating these personality disorders. But it's not always that these personality disorders will be treated, or even if they are treated, sometimes a lot of relapse occurs, especially when there is a stressful time. So more or less treatment, you can say, is a lifelong thing. Lifelong therapy, lifelong medications do help them, and they are able to function. But again, it's a challenge for the patients, also a challenge for the treating physicians and the treating psychologists also. But this does not mean that you don't treat them. Try to take it as a challenge. Try to identify personality disorders as much as you can in the clinics and in the hospitals, and try to treat them. Even if they recover partially, or if they recover a little bit, uh, still it's a win for us. So this is how you identify them, how you treat them. Now you know personality disorders. So with this we'll end the lecture and we'll open it for discussion. Any